As usual, only the science unpacked in this one, no made up stuff. I'll get to exactly how you can add 10 years to life expectancy if you follow this formula. A quick side note, then on to the science. Previous research in this area usually asks the same question: which exercise helps you live longest? So, is it cardiovascular exercise like running? Or is it strength training like weights, or even both? That means you will live longer. The last few years that question has been reframed, thankfully. Research is now better in many ways. Lots of metadata and meta-analyses allow comparisons of multiple studies. Many longitudinal studies have now been completed which have followed people over several years. Better studies, etc. So let's find the answer. Looking at the best available science to back this up, then I'll tell you the exact formula. We know that exercise reduces chances of getting cancer or chronic disease. This particular study looked at telomeres, the end caps on chromosomes, that shorten as we age and are used as genetic markers of lifespan. Those who exercised most had a telomere length approximating to an extra 9 years life expectancy. I will get to the exact formula as usual shortly. No matter what age you start, the benefits are there. This research comparing the lungs, heart and muscle of 40-year-olds and 70-year-olds compared to inactive individuals of the same age found heart and lung function and muscle strength the same as those who were 30 years younger. So how much exercise do we really need to do? Well, all the research shows even moderate exercise, like brisk walking for 150 minutes per week, can extend life by 7 years, even if you start a bit later in life. Amazing. But let's add some more years. Okay, so combining exercise is better, obviously. Strength training plus cardiovascular training is going to reduce the risk of dying by, wait for it, 47% according to the research. That's pretty impressive. Let's focus down now to the exact formula and some rigorous science first to confirm the evidence. 2 studies as examples. This study looked at 122,000 records at a medical center over a wide range of ages, of the sample up to 80 years old, and it found that those with the highest cardiorespiratory fitness, or CRF, had the highest survival rate. No upper limit was found to exercise and CRF. These results, using patients as a sample, showed that 150 to 300 minutes per week of moderate activity, that's things like walking, running or swimming, etc., combined with 75 minutes of vigorous activity, or a mix of both, is optimal, so for maximum mortality benefit. What's good to know is no harmful effects were shown amongst any of the individuals who reported doing more than 4 times the recommended minimum. Right, this is the last one. This study had a sample of 116,221 adults, not patients, followed over a 30-year period. It compared rates of moderate physical activity and vigorous physical activity. The finding: those least likely to die performed either 150 to 300 minutes per week of vigorous exercise or 300 to 600 minutes per week of moderate exercise, or an equivalent combination of both. Finally, just to tell you how to make it to 10 years plus, you need to add some lifestyle factors, 4 to be exact. Easy to achieve, kind of. These are not smoking, obvious one there, maintaining a healthy weight, eating a healthy diet, and finally consuming alcohol in moderation. Hopefully not too difficult, that one. And that's it. Have fun extending your lifespan. If you like watching today, please like and subscribe, as it really helps the channel. Thanks again for listening.